So a very, very warm welcome to all of you. Thank you for coming. Thank you for joining us for this workshop on incorporating integrated diagnostics in the precision oncology care. My name is Hedvig Risak. I'm a radiologist, diagnostic radiologist at Memorial Sloan Kettering Cancer Center. And it is my really great privilege to work with the co-chair for this workshop, Dr. Kojo Elenitoba Johnson, who is our new inaugural chair of pathology and laboratory medicine at Memorial Sloan Kettering. The sponsorship for this workshop on integrated diagnostics truly indicates and shows how this initiative has to be not only multidisciplinary, but interdisciplinary as well. Therefore, it is sponsored by National Cancer Policy Forum, but also by Board on Human System Integration and Computer Science and Telecommunication Board. It is all of us together that do have a chance to make integrated diagnostics a reality. For those of you that may not be familiar with the National Cancer Policy Forum, it was created by National Academy with the goal to serve as a trusted venue to examine high-priority policy issues in cancer research and cancer care. It's not advancing. Good, at least I'm the first speaker, so I can get all the bugs out. Another thing, the one thing about the National Cancer Policy Forum that is very unique. The forum is sponsored by academic society, by industry, and by cancer support community. So you really have all three prongs that make advancement in cancer, coordinated advancement in cancer care, and need to take this moment to say thank you to all of them. We are having more problems with slides today than usual, but that's okay. This slide is supposed to say that I am really grateful to other members of our planning committee, as well as truly grateful to the staff of the Policy Forum, especially Cheryl Ness, Erin Bellog, and Lori Bring. Should we stop and maybe you fix the slides? Something is very wrong. Maybe we stop and those are their slides, so it's not that I messed up, which I do sometimes. So board on a little bit about board on human system integration, because we may not be familiar with that. And it's really, their goal is to use a system approach to apply to human factors and human-centered design principle to improve individual and organizational performance. The sponsorship for that board is very interesting and includes U.S. Air Force Research Laboratory as well as U.S. Army Research Laboratory. The Computer Science and Telecommunication Board convenes the nation's foremost computer science, telecommunication, and information technology experts. This board is sponsored by National Science Foundation, National Institute of Standards and Technology, National Security Agency, Department of Homeland Security, Department of Defense, and National Nuclear Security Administration. I think it just illustrates the importance and really the role of this board. And we are truly honored that the members of the board agreed to serve on our planning committee. So the planning committee, this is just a big, big thank you. It is multidisciplinary, it is interdisciplinary, and it was a lot of fun putting this program together. There were many, many Zoom calls and many hours, and sincere thank you to each and every. Equally thank you to our National Academy staff, who always made sure that we know what to do. Even when we are late, somehow, always, everything turns out. So the head of the dome, Cheryl, thank you very much. What are the goals of our workshop? Many people would like to know if integrated diagnostics is a myth or reality. Is it a dream of few high-end academicians? They can write grants and get funded. I hope that this workshop shows us tremendous clinical need for integrated diagnostics. And this is our opportunity for our cancer community to discuss current state of the field, where we are, that we look at the opportunities as well as implementation, and throughout all of this, to challenges. Workshop speakers are encouraged to share their input on opportunity, always remembering to promote health equity, improve patient access, ensure that integrated diagnostics are well designed for patient care and clinical workflow, discuss best practice for oversight and evidence generation, and really share their vision of the future for integrated diagnostics. Today, there will be 5 sessions, and each session has outstanding speakers in their representative field, and we will have ample times for discussion. Tomorrow, there is a keynote session, followed by session on ensuring patient access and health equity. And then session 7, it's really a summary of each session and design how to move forward. With this in mind, I would like once again to say welcome. I would like for all of us in the room encourage to ask questions. When you do ask questions, please come to the microphone. But equally important, we have a large number of participants that registered online, and we encourage you to ask questions, put them in the chat box. This is like, if computer goes, they need help from integrated diagnostics. To ask questions, and we will answer your questions as well. With this in mind, it is really my great pleasure to introduce the other co-chair of this workshop, Dr. Kojo Elina Toba Johnson. Kojo, good luck, and it's all yours.